Hello there. I am Sarah Quinn here with another episode of Mix 94.1's Community. I'm being joined by Sheryl from NAMI. Thank you so much for joining us today.
Thank you. Thank you for having us. My name is Sheryl Falcone. I'm actually coming from NAMI, Stark County. And NAMI is the National Alliance on Mental Illness. It was started back in 1979, actually by two women who had sons with serious mental illness. And they felt like they needed some more support and some more education. So they started a small group of families. And since then, it has grown. There is NAMI National, and there are NAMIs in every state. And there's over 100 affiliates throughout the nation.
Wow, that's amazing. So the fact that people in Stark County and beyond can access these classes then for free is a great resource.
Yes. NAMI was actually started, and they help to improve the lives of individuals and families who are impacted by mental health conditions. And we do that through education and support. We do research at national level, and we also do advocacy. Our education classes that we offer, first of all, everything we do is free. We are a nonprofit, the largest grassroots organization in the nation that helps people with mental health conditions. And we offer three main core education classes. Our first one is called Family to Family, and it's geared for family members who have a loved one with mental health conditions. And they'll go over things like communication, how to take care of yourself as a family member, helping them find local supports and resources throughout Stark County, how to handle crisis if unfortunately that situation would happen with your loved one. And that is an 8-week course. It is, again, free. It's one night a week for 2.5 hours. It's actually taught by trained individuals, family members with lived experience with having a loved one with mental health condition. And there are 5 of us in staff. 2 are part-time, or 3 are part-time and 2 are full-time. The rest are all volunteers that help our organization work. We have over probably 130 volunteers that help us throughout the year, and we are so grateful for them. We wouldn't be able to do the work we do without them. Just going back to the other organization or programs that we offer peer-to-peer, which is also an 8-week course, 2 hours a night. And we always meet the same night. And it is geared for individuals, adults with mental health conditions. And it's also taught by peers, adults with mental health conditions who are working well on their recovery, and found that NAMI has helped them too.
I am such a big supporter for mental health wellness, and I'm so happy to be living in a day and age where the stigmatism behind mental health and seeking help and recognizing that you need help in and of yourself is starting to dissipate and go away. And I feel like one of the big ways for this stigma behind mental health to go away is education. So I think it's wonderful that NAMI offers these services and for free, and has this support that people can have right in their neighborhoods. Now, with COVID going on, all this stuff, is it all online, all virtual?
It is all virtual, as starting back in March when COVID first started, which has been new for us and many, many other people and other organizations. And so far, we are still working out some kinks, but they have gone very well. We actually have had people from other states, since it's virtual, our classes, and of course Stark County. And we just try to get the word out as much as we can. And hopefully we are out there to let other people know that we're here to help them.
Yeah, absolutely. Have you seen an influx too in people reaching out ever since COVID hit with the pandemic? Because I feel like people have been by themselves alone quarantining, and it makes them kind of do a little bit more introspective to say, hey, I need help.
Yes. In fact, we offer support groups virtually as well. And those are we have some that are for family members, some for peers. We have one that's actually for family members and peers. We have a support group that just started on Wednesday evenings. It's called NAMI Let's Talk. So if you just want to talk to somebody, we are also non-clinical, and that's important to know, meaning we're not therapists or counselors. We are people with lived experience. So that's important to know.
Absolutely. Now, if someone wanted to volunteer to be part of this organization and help with their lived experiences and everything else, because they believe so much in your message and what you're doing, how could they get in contact to be someone that helps?
That's a great question. You can go on NAMI's website, namistarkcounty.org, and you can just, ask the question that you want to help volunteer. And then you can also call our office, which is 330-455-6264. Now, we are working remotely, and the phones are answered several times throughout the day. We will get back with you.
That's wonderful. Well, thank you so much, Sheryl, for coming on. Is there any other information that you want to make sure that people know about NAMI before we part today?
Just hope that we see you. We're here to help you. And if you feel like nobody understands, we've been there. So come see us.
Thank you so much, Sheryl.
You're welcome. Thanks for having me.